There are 65 emergency rooms in Covenant's Emergency Care Center, and 18 of them are dedicated to elderly patients, the first such senior emergency department in the region.
At Covenant, we see about 93,000 patients a year. Over 18,500 of those were over age 65. And we've even had about 3,900 patients in the age group 85 to 95.
There are many reasons for the dedicated area for our aging population, which will surge as baby boomers reach retirement.
The seniors have more needs than the average population. Oftentimes they're on more medications, have a more extensive past medical history, past surgical history, and this allows us to use a little more resources.
We have a pharmacist in the emergency department. We can review their medications. We have social workers. Our nurses at triage will screen the patients, asking them certain questions. If certain questions trigger red flags, we get our social workers involved right away to see what we can do to help the patients, whether it's a financial issue, issues getting food, issues with transportation, and also whether or not they are considering going to a ECF or an extended care facility where they can get more help. We try to work with them and see what services we can offer and make their stay a little bit easier for them.
Emergency doctors know that seniors also require more examination time to fully understand what is making them sick.
It's a little more complex. They have symptoms that aren't as obvious. So they may come in with some very mild abdominal pain but be full-blown appendicitis, where in a younger patient it'd be more obvious.
Covenant's Senior Emergency Care Center is in a quieter section of the hospital.
We can isolate them and keep them away from children who carry, especially this time of year, different respiratory ailments, which may be nothing for a 5 or 6 year old child, but an 85, 90-year-old man or woman could be life-threatening. And so that's another reason to isolate them back here.
Having dedicated private rooms also means customizing the interiors, larger letters on boards, and bigger numbers on clocks. And that's not all.
If they forget their glasses or if they forget their hearing aids, we have devices so we can communicate better with them. Also, the floors are non-slip. These mattresses that are on the gurneys in here will be low-pressure mattresses, and we also offer chairs in some of the rooms so that people have an option of sitting in a chair instead of sitting on these gurneys.
If they're 65 and older, that's what we consider to be in senior care now.
Senior care facilities from several counties toured the facilities today, learning how clinical staff can better integrate patient information between them.
Well, this is a community effort here. We're trying to take care of everybody, and this initiative in particular, we're looking at our seniors and how can we work together to have that communication as good as it can possibly be.
Covenant staff is excited to hear what the community thinks about the new Senior Emergency Care Center. We encourage your thoughts when you visit.
They can either give their feedback through a survey, they can tell us at the time, there are forms in the room, they can write things down about their visits, and personally I ask them, is there anything else we can do for you to make this a better experience? I explain what this concept is because this is new for them too, and a lot of them will give me some information to feedback that I'll take to the committee and discuss.
If you would like more information on the Senior ECC, check out our website at covenanthealthcare.com.